Smart Chiropractor Show. It is time for Clinical Conversations. This is when we take a moment, quite a few moments as a matter of fact, to explore clinical conversations in and around chiropractic practice. We bring in an array of world-class experts, and we've been highlighting some of those experts who were featured in Axis 2021. That was last year, our clinical summit that we put together. Be on the lookout for dates for Axis 2022 coming up soon. Today we're going to feature Dr. Lisa Thomson. She's actually now the president of the California Chiropractic Association. She also is a chiropractor dedicated to sports care out in California, and she put together a fantastic presentation around ACL tears, risk, recovery, and research. We're going to take a snippet of her presentation and give you a little insight into ACL care with Dr. Lisa Thomson.
Hello, everyone. Thank you for having me. I am Dr. Lisa Thomson, and I am going to be talking to you today a little bit about ACL tears, what the risks are, what recovery looks like, and what some of the latest research is. Just a little bit of our learning objectives here. We're going to start with a little bit of a review of the anatomy. We're going to talk about the prevalence of ACL tears, and that will help illustrate why this is important for especially chiropractors to understand. We're going to talk about some common mechanisms of injury, what the examination would look like, how we want to look and see if we have a potential ACL tear, what tests we should do, what the recovery looks like, and some return to play considerations, and then we'll go through a quick review of all that. So really quick, just a little bit about me so you know who you're listening to today. So again, I am a chiropractor. I practice in the greater Los Angeles area, and I am a huge sports nerd. If you know me, you know that sports are my life. And I was a soccer player. I played soccer in high school and all through college, and then when I moved out to California, I found a women's league in Long Beach to play on, and I also tore up my knees playing soccer. So not to date myself, but in 2000, I tore my right MCL and PCL. I had a goalie dive at my knee, and my leg bent the wrong way, and tore those two. I never had that repaired, so I still don't have a PCL. And I tore my left ACL in college. I stepped wrong to shoot a soccer ball, and my knee went out. And then in that women's soccer league in Long Beach, I again tore my right MCL. Here's a quick video that I wanted to add in that helps to demonstrate a lot of the movements that some people are asking of their bodies. A lot of our athletes are asking a lot of their bodies, and this is why it's important to make sure their bodies move appropriately. So again, this is Neymar. I want you to watch his ankles. I want you to watch how his hips are moving, that side to side motion. He moves fantastic. A lot of our patients can't move like this. So it's important to understand and appreciate how much some of our athletes are really asking of their bodies to make sure that things are moving appropriately and to hopefully make sure that they're able to play their best and for a long time. A little bit of anatomy review here. Here is the knee, of course. And I guess the image kind of speaks for itself here, but the ACL and PCL are deep in there, and they're going to cross through the center of the knee, and the ACL is going to be the one that's preventing that forward movement, and the PCL is more preventing the movement from the back. The PCL is more of it's more of a popular injury in like car accidents, stuff like that, where they hit the dashboard. But the ACL is more common. Well, we'll get into the common reasons for ACL tears here in a sec. So why should we care? I think most of the people watching the presentations for all of these are chiropractors. There's a lot of chiropractors here. Why should a chiropractor care about knee injuries? Why should a chiropractor care about ACL tears? So there are between 100,000 and 200,000 ACL ruptures per year in the US alone. And obviously not only is that going to impact our athletes, but it's going to impact anybody can tear their ACL. So very common injury. It is a potentially life-changing injury for some of the athletes, but it can be a very big deal, and it's It's ground up, so that's your part of your foundation there. So very big deal, very important to at least understand the basics and what the latest research is saying as far as what people should and shouldn't do to hopefully prevent ACL tears and what the future looks like after there is an ACL tear. So you should care. All right, I like to, especially on these online presentations, I like to add some humor because it's hard to sit and watch a screen for too long. So, little quick joke there. All right, so what causes an ACL tear? What's the most common way we get an ACL tear? So a sudden change in direction, improper landing after jumping, or in my case, stepping to shoot a soccer ball, pivoting on a planted foot, sudden deceleration, so if you're going to stop real quick, and direct blows to the knee may all cause ACL tears. So of course there are others, but those are the most common ways that people are tearing their ACL. And if you did not know, women have a much higher ACL tear risk than men. And there's a couple reasons for that. We think there's a lot involved, but I will get into those a little bit more here in a minute. But women experience tears up to 9 times more often than men. Lots of potential risk factors. So again, ACL tears are really complicated, and I hope more and more research continues to come out so we can help more people not go through what a major injury it is. So leg strength matters, muscle mass absolutely matters. Muscle imbalances can play a huge role. Increased joint laxity, higher BMI, so the heavier you are, the increased chance you have of tearing your ACL. Artificial surfaces are increasing the ACL tear rates. Testosterone levels, estrogen levels, where you're at if you're a female, where you're at in your menstrual cycle. Fatigue can play a huge factor. Pelvis shape, quad dominance, ACL size, the actual size of the ACL, and the femoral notch. So again, lots involved. Most common sports that this happen, or that the tears happen with, are the ones that require a lot of pivoting and jumping. So especially pay attention if you treat a lot of basketball players, soccer players, downhill skiers, lacrosse players, of course even football. Those are the most common sports that you're going to see the ACL tears in. It's pretty obvious that trauma can cause an ACL tear. We see it all the time with football injuries. But overuse is just as important, if not more. So if somebody is playing a sport that, especially the ones we just mentioned, and they're playing a long time, they're playing for many years, and they have any of the other risk factors, the overuse injuries, the overuse ACL tears are going to happen also. So just another reason why it's so important to understand and appreciate some of the risk factors so we can hopefully help our patients avoid this major injury. A little bit more on prevalence here. So the landing position matters. When women land from a jumping position, they tend to land with the knee in a straight position, transferring the force of impact to the knee joint. Men tend to absorb more of the energy of impact by landing with their knees bent. In valgus alignment, women have an increased valgus angle of their knee, and movements of the extremity place more stress on the knee ligaments as a result of this alignment. And I'll talk a little bit more in a minute here about Q angle and the valgus alignment and just illustrate that a little bit more so you can see why that would increase the rate of the tear. Real simply, you don't need to really know all the details about the Q angle, but simply the female's hips are wider than the male's. And of course that's because females, we can have babies, which increases that Q angle. And why this is important in regards to ACL tears is because it puts more stress on the knee. It increases that valgus stress, as you can see there, and it puts the female at a increased risk, assuming that the female has a wider Q angle than the male. So that's what the Q angle is. That's why that matters. Okay, so how do we know if a patient has an ACL tear? If somebody comes into our office, how do you know? Well, one, most likely the knee, if it just happened, the knee's going to swell up quite a bit. There will be a lot of fluid in there, a lot of inflammation, most likely. Also, I'm going to show you the anterior drawer test and posterior, but I also want you to keep in mind that sometimes, especially with the anterior drawer test, the hamstrings will tighten up so much that sometimes you'll get a false negative here. So if you suspect it at all, of course, you're going to need to order an MRI. But here is the anterior drawer test. Just going to pull it forward a little bit, a little pressure back, compare to the other side. And this is actually my knee. Since I don't have a PCL, I can show you what a positive test looks like. So obviously a lot of extra movement there. It's not supposed to do that. I know we're talking about ACLs, but basically if it was the ACL, it would go forward just a little bit more versus mine goes back a little bit more than it should. And good news, you can play soccer with a torn PCL because I still play. Okay, Lachman's test. Here's another, basically the same movements here. But just another way to look at it, depending on your preference. I'm more of an anterior drawer kind of girl, but if I'm on the field and somebody went down, which is the best time to test for an ACL tear because the muscles don't have time to tighten up yet. If I'm on the field, this is more what I am gonna do first. So patient comes in, knee injury, we do some tests. We think that we find out they have a torn ACL, get that MRI. Of course, they should also be seen by a orthopedist. We want them to also get that opinion. I'm always about the team approach, but this is a pretty obvious one. But there are some things as the chiropractor that we should understand and appreciate as far as what we can do to help, what our role might be in this type of injury, and yeah, we'll go from there. So I don't care if this patient, if we're talking about somebody who has an ACL tear or one of your many other patients, ask on the first visit what their goals are. Why are they there? Why is this person coming to see you? It helps tremendously to determine the treatment that's going to be most beneficial and how aggressive that treatment should be. For example, if you have a high school senior who just wants to finish their season and they're never going to play their sport again, you're going to treat that person differently than say a high school freshman who wants to play professionally. The same injury might be treated completely different. So always ask their goals, find out why they're there, and find out how, and that way you can determine a lot. So again, it doesn't matter who this patient is, doesn't matter if it's one of your athletes or anybody else, make sure you're asking their goals on their first visit. When it comes to treatment, this study found, and this study is a little bit old, but it found that the knees that had been treated by repair and augmentation of the ACL were significantly more stable and had significantly fewer subsequent meniscal tears versus knees that were not surgically repaired. So ACL's torn, now what? And of course, this isn't going to be our decision to make. But just so you're aware, the surgical options are a patella tendon graft where they take a piece of the patella tendon out and pretty sure they take a little piece of the bone with it where it attaches on each side, and that becomes the new ACL. The hamstring can also be done in the same way. Obviously, they're not going to take a piece of bone from each side from there, but the hamstring can be done the same way. They take a little piece of that tendon and replace that for your new ACL. And then you could also get or the patient could also get a cadaver donor, a cadaver new ACL. I put this slide in here for a couple reasons. One, because I love Sue Falsoni and I love her teachings, but the cause of the symptoms, the motion segment, is just as important as the source of the symptoms. We must consider health in its totality. So I think especially when it comes to the ACL injury, this quote is incredibly relevant. So, and I think as chiropractors, we're really good at understanding and appreciating this more than some other professions. We understand that if somebody comes in with a knee injury, we need to look at a lot more than just the knee. I hope we understand that anyway. I think we're getting better as a profession, but we need to look at more than just the knee. And that might be different motion segments, that might be how somebody moves, that might be their nutrition, that might be their sleep, whatever it is. So this is a very relevant slide when talking about ACLs. And if you treat athletes at all, I highly recommend you get her book. When it comes to return to play, again, this is not something that the chiropractor is most likely going to be the first person making this decision, but it's important to know what the research is saying about when athletes should be coming back from an ACL tear. So this is from a recent study, 2020. Returning to knee strenuous sport before 9 months after ACL reconstruction was associated with an approximately 7-fold increased rate of sustaining a second ACL injury. Achieving symmetrical muscle function or quadricep strength was not associated with new ACL injury in young athletes. So, I mean, obviously the first sentence is what we're looking at here. So before 9 months, that's a long time. Kids are going back a lot sooner than that. I'm hoping that and I'm seeing less and less of it, but kids are going back a lot sooner than that. I personally went back, and every time I say it, it sounds crazy, but I went back 4 months after I tore my ACL. I was playing soccer 4 months later. So I'm very lucky I didn't get hurt again. So the 9 months is important. I think in addition to this, there's a lot of other things that are important, assessing more than just the knee itself. So often only the knee is looked at when it's determined whether an athlete's ready to go back or not. And I think we should be looking at a lot more than just the knee.
Right, that was Dr. Lisa Thomson, a presentation that she had given us for Axis 2021. A couple things that stick out to me there, Jason, are number one, how incredibly dynamic our bodies are. The second component of that is people suffer injuries like this. It just happens, whether through sports, you step off a curb the wrong, whatever it might be. There's a variety of things that can cause extremity issues. In this case specifically, she was speaking about ACL issues. And when surgical intervention needs to take place, there's trauma associated with that. And that's what I take away from our last slide there is returning to play too soon after traumatic injury and then a traumatic surgery, no doubt increases the opportunity for a second and a future injury. We see the same thing in the spine. We see it in extremities, but the takeaway, the positive side of that is, wow, I saw her knee moving and shaking all over the place, yet she is still very functional because our bodies have musculature, we have support systems, we have everything built in and around to support, where even if we're not optimal in one area, which most of us aren't by the time we reach skeletal maturity, we have this dynamic ability, intelligence, however you want to define it, that gives us the ability to function at a high level for a significant amount of time. The key component is if you take care of things, if you're proactive with your health, and if you do the things necessary to keep the adjacent body regions, the adjacent musculature, strong, healthy, and functional. Jason, what were your takeaways there from Dr. Lisa Thomson's presentation?
That was it. She's was remarkable. It was great to talk to her and watch her presentation. And, she's really a go-getter. She's, both involved politically. She's involved in her practice. Sports as an athlete. It's really wonderful to see. And I think you said it beautifully. These are all examples of reasons why we should do what we can for ourselves and to teach our patients, right? We talk about teach and invite consistently. Here's another great topic to teach people. Here's how you can reduce your risk. I'd like to say avoid, but you can try to avoid, things happen, but at least reduce your risk of these bad things happening. And it's not just athletes in competition. It is regular people who just let their bodies decay, atrophy, and just don't keep them moving. It is use it or lose it. It's overly simplified, but there's truth to it. So, we also have to remember just got to bring it up, that we, even with nutrition and muscles and strength and all that stuff, that the nerves to the leg come out of the lower back and the spine, and keeping our spines clear on a proactive basis can only help the matter, can only help make sure that whatever we're doing down in our legs and our knees, etc., is working to its highest functional ability innately and on its own. So great presentation. Access was a wonderful event. Looking forward to having it again in 2022. Just great docs sharing great information with great people like all of us and all of you. It was a great event. She did terrific.
Yeah, thank you, Dr. Lisa Thomson, and maybe we'll have her back for a second go around in Access 2022. I know she has a lot of experience in the sports realm. Hey, if you like that video, be sure to subscribe to The Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.